Currently, best practices and guidelines are most often developed at the population level. Because of this, patients are treated based on the average factors that affect others in their current situation, rather than individualized to them. At the same time, healthcare organizations, along with individual providers, are being asked to accept a larger share of the financial risk of caring for patients. These elements present a critical need for a means to predict individual outcomes and for a tool to help illuminate the outcomes from alternative treatments based upon the patient's individual risks. Doing so can lower the overall cost of care and improve outcomes for both patients and healthcare organizations. Meet Mike. Mike is a 53-year-old white male that is about to undergo angioplasty for chest pain. Mike's treatment should be influenced by his unique clinical characteristics. The best treatments for Mike may not be what is best for others. Mike doesn't care about what's best for most people. He cares about what the best option is for him. By identifying Mike's individual risk factors, clinicians are better able to make informed decisions to determine the optimal protocol of care. This breaks Mike down from a sample of millions to 1 in a million. ePrism provides this clinical risk modeling at the point of care. It supports the delivery of evidence-based medicine, one patient at a time. Such personalized evidence is the key to helping clinicians, hospital administrators, and other care providers perform at an optimal level. Carried further, individualizing care translates to better clinical and financial outcomes, increased shared decision-making, and the most appropriate use of therapies and interventions. Better outcomes are at the core of why the ePrism solution was developed. ePrism can overcome the risk treatment paradox. A counterintuitive trend exists where the most aggressive procedures are often performed on patients who need them the least, and less often in those who could benefit the most. Compared to existing or traditional consent forms that are generic and uninformative, ePrism represents a breakthrough by presenting personalized evidence that improves patient understanding. An informed patient is a happier patient. Shared decision-making leads to enhanced patient experience and increased patient satisfaction. With the ePrism consent form, Mike's physician is empowered with the tools to open up bidirectional discussions to make the process simple to understand, educational for Mike, and provide actionable data to deliver safer, more cost-effective care. In a study of 100 surgical patients using the traditional consent forms, 44 could not describe their procedure, and 27 did not know which organ had been operated on. ePrism eradicates this and has been proven to improve patients' understanding of their risks and their engagement in shared decision-making. Shared decision-making allows for both the physician and patient to have peace of mind and confidence prior to any procedure taking place. This confidence in the optimal level of care carries significant weight throughout the hospital administration. By identifying the right course of action, Mike's overall cost of care has been dramatically reduced. This is a result of a more cost-effective use of drug therapies, a greater avoidance of costly readmissions, and a more appropriate use of interventions, thus reducing the life-cycle healthcare costs for both Mike and the hospital. In addition to a reduction in costs, the ePrism tool provides a user experience that is much less disruptive to a clinician's workflow. Current users are completing the ePrism assessment in an average of about 90 seconds. This means that Mike's clinician has more time to focus on him and the other patients waiting for care instead of navigating through a complex user interface that is tangential to the routine flow of care. This asset to workflow continuity is a vital element in enabling evidence-based care to be delivered on a patient-by-patient basis. These benefits are helping ePrism build a reputation with hospitals across the country. Our strategic relationships with leading research partners and institutions provide an unmatched foundation for delivering the best models and care. Through a better understanding of each patient's risks, clinicians are able to deliver higher, more affordable care. ePrism is at the epicenter of personalizing evidence and improving outcomes. Health Outcome Sciences, personalizing evidence, improving outcomes. Visit h-outcomes.com for more information.